Okay, so today I'm just going to be providing education for a healthy pregnancy. So to start out, I'm just going to discuss what to expect from appointments. So your first appointment will probably be between 8 and 10 weeks to confirm the pregnancy. At this appointment, you could expect a transvaginal ultrasound as well as a blood draw. The blood draw is going to likely measure your HCG levels, determine your blood type and Rh factor. They will likely want to get a complete blood count, determine if you have hepatitis B surface antigens, as well as antigens or infections that for rubella, varicella, or Fifth disease. They may also want to screen for STDs like HIV or syphilis. The provider will also use likely use ultrasound to determine the location of the pregnancy, to make sure it's not ectopic, like in the fallopian tubes or implanted outside of the uterus. They may also want to determine the age of the fetus as well as the estimated date of birth. You can expect a prenatal checkup every 4 weeks from the beginning of your pregnancy until week 30, and then you can expect an appointment every 2 weeks from weeks 32 to 36. And then you can also expect an increase of appointments to be weekly from 37 weeks until you give birth. At every checkup, you could expect the provider will want to assess your weight, your blood pressure. They may want to get a urinalysis to monitor proteins or sugars in your urine. They will also want to monitor the baby's growth. They will probably do this differently at certain at certain appointments. They'll usually just measure your fundal height, but they will also use ultrasound at certain appointments to monitor the baby's growth as well. They'll also want to monitor the baby's position and heart rate. You'll have your routine prenatal care from weeks 8 to 20. You will likely have the provider screening for abnormalities in the fetus, as well as determining the location and condition of the placenta. They may also want to identify if there's any signs of twins or multiples in the pregnancy. They will also offer prenatal screening specifically to identify some chromosomal abnormalities as well as neural tube defects. For weeks 20 to 30, the routine prenatal care will include a gestational diabetes screen at around 24 to 28 weeks. They'll do this with a glucose tolerance test. And towards the end of these weeks, they'll probably start to discuss labor and birth plans with you. In your prenatal care from weeks 30 to 40, the provider will discuss screening for group B strep at around 35 to 37 weeks. And they may also instruct and educate you on how to observe your baby's kick counts. So you'll just do this by mom laying on her back and measuring how long it takes to get 6 kick counts. At 36 weeks, the provider will also probably begin abdominal palpation to assess the fetus's presentation and make sure that they're in the right position for a safe vaginal delivery. Throughout your pregnancy, you'll also want to pay close attention to your nutritional intake. So you will want to make sure that you're getting 7 to 8 servings of fruits and vegetables, 6 to 7 servings of grains, 2 to 4 servings of milk or milk alternatives, and 2 servings of meat or meat alternatives throughout the day. That should be every single day. And then starting at your second and third trimesters, you're going to want to add 2 to 3 servings per day from any food group into your diet. You will also want to start taking a daily multivitamin starting at the very beginning of your pregnancy or even before, all the way until the end of your pregnancy or into your postpartum period. The multivitamin needs to include folic acid and iron to help reduce the risk of birth defects. You will also want to avoid certain foods during your pregnancy, so you'll want to avoid raw or undercooked meats, as well as fish with high levels of mercury. So that would include fish like tuna, shark, swordfish, marlin, things like that. You can have some, but you'll want to avoid it or reduce the amount you intake. You'll also want to avoid consuming more than 200 to 300 milligrams of caffeine each day. And you should also avoid liver and liver products because they have a high concentration of vitamin A. Excuse me. You are allowed to partake in exercise. If you're already physically active, meaning you exercise for about 150 minutes per week at a moderate or moderate or vigorous intensity, you can continue to exercise for 150 minutes per week at a moderate intensity. But when you do this, you'll want to make sure that 150 minutes is spread out for at least 3 days or more. So you don't want to do all 150 minutes in one day. The exercises can include aerobic and resistance exercises, as well as things like yoga or gentle stretching. Moderate intensity workouts should raise your heart rate slightly, and they can leave you slightly out of breath, but you should be able to carry out a conversation and still talk. If you're not able to do that, then the intensity is too high and you have to lower it. You need to avoid high intensity workouts, heavy lifting, and activities that have a high risk of falling or like high collision exercises. So that would include things like horseback riding, downhill skiing or snowboarding, hockey, gymnastics, mountain biking, wrestling, things like that, or like football or basketball, high intensity or high contact sports you want to avoid. You also should expect to gain weight during your pregnancy. There's different amounts depending on what weight you started at. So if you started your pregnancy underweight, meaning your BMI is under 18.5, then you should expect to gain 28 to 40 pounds by the end of your pregnancy. If you started your pregnancy at a normal weight with a BMI of 18.5 to 24.9, then you should expect to gain 25 to 35 pounds by the end of your pregnancy. If you started your pregnancy overweight with a BMI of 25 to 29.9, then you should expect to gain 15 to 25 pounds at the end of your pregnancy. And if you started your pregnancy obese with a BMI of over 30, then you should expect to gain 11 to 20 pounds by the end of your pregnancy. Some common complaints that you might have, there is lots, but some of the complaints that are normal, however uncomfortable, would be increased fatigue. So you will likely feel an increased fatigue at the very beginning of your pregnancy because of hormonal changes. And you may also feel it towards the end at the second and third trimester because of reduced sleep or frequent waking from just discomfort or needing to go to the restroom. You can relieve this just by resting more frequently. You can take naps or just reduce the amount of strenuous activity throughout the day and take it easy. You may also experience a lot of discomfort or pain in different areas of your body. So it's normal to experience some back pain, hip pain, rib pain, heartburn, tender breasts, things like this. These discomforts are just from your body changing, your organs rearranging as the baby grows. The baby may kick on your ribs, or just him or her expanding can push on your ribs. Some ways to relieve this is to sleep with extra pillows supporting different areas of your body at night. You can also get a belly band that supports the weight of your stomach and relieves some of the tension on your muscles in your back and stomach. You can also make sure to wear clothing that's not too tight or uncomfortable. You can wear more comfortable shoes that aren't too tight or just uncomfortable on your feet in general. You can also talk to your provider about taking certain antacids for heartburn, as well as some over-the-counter pain relievers like Tylenol or ibuprofen. You can also expect a complaint of an appetite change. At the beginning of the pregnancy, you'll likely feel a decrease in appetite due to nausea or food aversions, but you may also feel an increase of appetite at the beginning as well because of higher demands from your body growing a human. In the second and third trimester, you may feel hungrier more frequently, but you may also notice that you'll get fuller quicker because of the decreased room in your stomach because of the uterus pushing on the stomach. A way to relieve this is just to eat smaller meals throughout the day more frequently rather than less frequent larger meals. Lastly, I want to discuss some warning signs that are not normal and that require immediate attention. So one of the warning signs during pregnancy is a headache that will not go away. So it's normal to have a slight headache throughout pregnancy at different times, but if you have a headache that is severe and will not go away, this could be a symptom of either preeclampsia or even a stroke, and both of these conditions are very serious and require immediate attention from the provider. You might also experience some normal swelling in your fingers, hands, ankles, feet, things like that. But if the swelling is severe and accompanied by redness and pain, and if it's in one of your arms or legs rather than both, this could be a sign of a blood clot, and this requires immediate attention to prevent the blood clot from dislodging and traveling somewhere else in your body, like your heart, your lungs, your brain. Another warning sign to pay attention to would be decreased movements or just a cessation of movements with your baby. Every baby's movements is kind of unique, but if it's a change from what your baby normally does, then this is a warning sign that you'd want to get immediate attention for. If the baby stopped moving, stopped or decreased moving, this could be a sign of not good enough perfusion to the baby from the placenta, and you'd want to see a provider immediately.